morning. Welcome. So I just want to say a huge welcome to everybody. Thank you for joining us this evening or this afternoon or lunchtime, wherever you may be, to hear more about the Masters in Emergency and Resuscitation Medicine program here based from London, but run as a international and interprofessional distance learning program. We have got a couple of our students with us already, and we've got few more students hopefully joining us as they finish their shifts. They're stuck on critical care transfers and various other things, but they'll be joining as we go through the program. My name is Libby Thomas. I'm one of the faculty members on the program, and I'm joined today by Tim and Amy from the faculty. Do you want to introduce yourselves quickly?
Hey guys, so for those of you here live, lovely to see you and interact with you. Those that are joining us later online, thank you for your interest. My name is Tim Harris. I've got a background in emergency medicine, intensive care, pre-hospital care and retrieval. And I'm looking forward to telling you a little bit about why we set this course up. And I'll hand over to Amy.
Hi everyone, my name's Amy and I'm the program administrator. So I deal with all sorts of queries that new students, prospective students may have, and also just dealing with module content updates, exam procedures and administration, all that kind of stuff, all the background stuff.
Everything that keeps the program running and working, which is really super important. So the plan for this evening is Tim's just going to do a very brief overview of the program, just so for those of you who aren't entirely familiar with it, and then we're going to hand over to the students and they're going to take it in turns to tell a little bit about themselves and different elements of the program. If you've got specific questions, please do put them in the chat, or if you want to put your hand up and ask questions, then please do that as well. And that's what we're here for. It's about you getting the most. Hopefully some of you are already signed up to the program. I know you are. So hopefully some of you are thinking about it and not sure whether you want to convert to it. So let this be your opportunity to ask us more questions and check that this is the right thing for you. And with that, I'm going to hand over to you, Tim.
Libby, thank you so much. Ladies and gentlemen, lovely to meet you and I look forward to studying with you. So I've just got a few slides to talk a little bit about why we set this up and how it runs. So we're here, most of us, because we're interested in emergency and resuscitation medicine, and we run a 3-year degree, a 2-year diploma or a 1-year PGC, which looks at emergency medicine resuscitation. There is an option in the 2nd year to turn that basic E&R degree into one with an interest in tactical, military, austere and operational medicine. And that's really designed to 2 distinct groups. Those of you that have a tactical military role and those of you that are interested particularly in expedition medicine. Secondly, we have a paediatric emergency medicine. This is very well run by Tessa Davis, who many of you may know from Don't Forget the Bubbles. And all these have a very similar structure. They're over 3 years. Now, that's pretty unusual for an MSc. The reason we set these up under a 3-year, not a 1 or 2-year program, was we wanted people to feel they could study while working full time. That's really clear feedback from the students. And also, we wanted people to take what we teach them and integrate it into their practice. And if you teach slower and you integrate slower, you remember more. So Libby, I and the faculty work at Queen Mary University of London. Now, this is part of the UK Russell Group. The Russell Group is the top 16 universities in the UK by a number of metrics, things like research output and feedback. It is a reasonably large university for UK standard. It's just got a shy under 30,000 students from 160 countries. It's a university that is particularly recognised for its diversity. So we have a huge range of just about everything, a huge range of students, colours, courses, religion, backgrounds, and it is also very well respected for its SMD. That's the School of Medicine and Dentistry. We've been in the top 3 in the country consistently. We were rated #1 back in London in 2020, and the SMD is in the top 5 research institutions for medicine in the world. Now, the building you can see in this picture is the Blizzard Institute, and that is our home. It's a novel building. Beneath that ground, there is a lab, And the part that you can see is where that lab integrates into education and teaching. So we bring research scientists and educators together with clinicians under one building. And this is a fascinating place to work, and it's a wonderful hybrid of discussion and ideas. So we have a very well respected faculty. Ben Bloom leads education, Tessa leads peds, Paul leads the military and module 4. He's a joint cardiologist and pre-hospital military. Libby's background is in education and leads on summer school and CRM. Stephen Thomas is a professor of emergency medicine at Harvard in the US, and he leads on our research year. Chet Trivedi is a max-fac surgeon and emergency physician, and Darryl Wood has a particular interest in trauma and snakebite. He's an emergency physician who trained in South Africa, I guess hence the trauma, and now is in East London. We are supplemented by a diverse and highly respected faculty, and we are immensely grateful for what these people give us. If you look at the top row, Chris Carball is a world expert in PEs, professor of emergency medicine at Harvard. Brian Burns from Life in the Fast Lane from Sydney, Australia. Gareth Davis used to run London HEMS, doctor for the TT, and now leads the emergency medicine resources in the Isle of Man. Then we've got Mauricio, who is the immediate past president of the Intensive Care Society. Below him, Mark Wilson, who is the chap that put together the SAMAP and is a neurosurgeon as well as a pre-hospital doc. In fact, Mark will tell you that the best people to intubate you are neurosurgeons, because he has a 100% track record, and neurosurgery is the only specialty without a failed airway. That means a second attempt, by the way, not a failed airways and can't intubate. But then again, he's only intubated 4 patients, so perhaps that's why. And immediately to the right of him, as you look at the screen, there's Mervyn Singer, who's Professor of Intensive Care here in London, and so on. It is a great faculty, and we are absolutely humbled to work with them. So why might you want to study emergency and resuscitation medicine? So there are many of us that believe that the resuscitation area of emergency medicine, and arguably of paramedicine as well, is probably a subspecialty interest. Now, it's only about 0.5 to 1% of the patients we see in the average ED, but it takes something like a quarter of our time and resources. And of course, the decision making you make on the critically sick has a pressure in terms of accuracy and time that is completely different to even the rest of emergency medicine. And also, of course, the act of resuscitation crosses the boundaries from pre-hospital care into emergency, and then, of course, into the intensive care, the operating room, and those that need resuscitation on the wards. So we see that resuscitation medicine itself crosses professional boundaries. Whether you're a paramedic, whether you're an ED nurse, whether you're an emergency physician, intensivist, an anaesthetist, an acute physician, a proportion of all of your work is resuscitation. And we welcome into this master's doctors, paramedics, and nurses in recognition that we share a dream for excellence in this area. What we hope to teach you in these 3 years is how to develop your skills. This is predominantly an education and clinical master's. We are not trying to turn you into researchers. And while we do have a 3rd year led by a Philadelphia club scientist, that means somebody in the top 1% of all scientists ever lived. That's Stephen Thomas, as I mentioned. The primary purpose of this is clinical, helping you take a leadership role in running your clinical area, in teaching in your clinical area. Now, this is a slide from last year, but you can see we welcome paramedics, doctors, and nurses. And we have relatively new paramedics, doctors, and nurses, and we have others with 10 or 15 years experience. And they come from all over the world, just sharing that passion for medical excellence. Now, this is an online course. We looked at a number of models, and feedback from students was really clear. They wanted to be able to do the whole course online with an option to meet. And indeed, we meet at summer school, which is very ably run by Libby. Summer school lasts a week, and we look at simulation and ultrasound. We've got a number of plenary speakers, but it is not compulsory. And that, of course, is because some of you may not simply be able to travel to the UK for summer. What is compulsory is that you do the lectures. We release somewhere between 3 and 6 lectures a week. That's anywhere from 3 to 6 hours of recorded material. They're recorded by world experts. It's the same standard as if you went to an international conference. We meet every Thursday for a 1-hour tutorial. This gives you the option to bring papers, to bring cases, to discuss points of the lectures, or for us to simply question you and explore how well you've understood. In year 1, we focus on the basics of resuscitation. In year 2, we look at some of the subspecialties. I'll look at that in more detail in a minute. And year 3 is a scientific paper. The last week of each of those models is a human factors curriculum, which is very well led by Libby. And we have some linked courses to teach you SPEAR, ROBOA and POCUS. And we can talk more about those later as needed. So in year 1, we start off teaching you about the fundamentals of research. This is how to find papers, how to search the web, how to search a library, how to search PubMed, how to appraise papers. This is level 7 education. What we want to do is make you independent. The whole purpose of a master's is that you learn to source information, to assess that information, to come up with your own ideas, to develop your practice, to challenge your guidelines, to challenge yourself and challenge your peers. So basic academic knowledge is where it all begins. We then start looking at the pathophysiology of shock and the tools of resuscitation. We then transcend into the clinical arena, starting with the perhaps most difficult and immediate areas, cardiac arrest and airway management. We end year 1 with emergency care. This is a broad look at all those diseases that contribute to organ failure, respiratory failure. So we cover asthma, COPD, diabetes, DKA, myocardial disease, and so on. In year 2, we delve down a little bit into the specialties of shock. We start off by looking at trauma and trauma shock. We then have a module that looks at diagnostic tools, how to interpret blood gases, how to interpret ECGs and chest x-rays, but most of this is about ultrasound, because if you want to make a clear diagnosis of the etiology of shock, you need ultrasound. We then look at toxicology and CBRN, and we end up with a choice of either pre-hospital or pediatrics. I lead on the pre-hospital and Tessa leads on the peds. For those of you that want to look at tactical, military and austere environments, you have the option, instead of taking the that's a module 6 with ultrasound and diagnosis, you take a care on the battlefield module. In year 3, we have replaced the traditional master's thesis with a scientific paper. The reason we did this is most of our students did not want to do a PhD, so doing a 10,000-word thesis was not valuable to them. What they wanted was something on their CV to show their colleagues that they had learned some science and they had a focused interest, and they had reached a standard where they could present that material at conference and publish it. Now, you don't have to publish. We'd love you to publish, but you don't have to publish to pass. So we have an international outlook. Somewhere between a quarter and a third of our students are international, i.e. working outside the United Kingdom. How do you get in? Well, if you're a doctor, you need to have finished your degree, and we like you to have 2 years experience. If you're a nurse or a paramedic, you need to have finished your degree. And while we prefer you to have experience, a number of nurses and paramedics actually wrote to me and said, you know, my degree had so much clinical material that I would like to move straight from my basic degree into a master's. And if they convince me that they've done enough clinical material to absorb master's level education, we accept them with less than that 3 years experience. Doctors, we do encourage to have experience simply because while the doctors do get clinical experience, a lot of that is not in resuscitation, where of course paramedics are spending their time pre-hospital, and proportionately, most of them in training will see a sicker proportion of patients. So how do we assess you? We're very keen that the assessments teach you to be better teachers. So we want to see how you communicate the written word and the spoken word. So the assessments are written assignments, that's 1,500 word essays that allow us to explore a small part of what you've learned in that module. We also look at some basic ability to critically appraise papers, so to be presented with a journal article and to tell us what you think the take-home points are, and to say how well or badly that paper was written. And of course, that's a key skill for your future leadership. You need to be able to look at the information and see if the information in front of you should influence your practice or not. And we do get you to do one presentation in year one and a presentation in year two. And that's because most of you are not going to be researchers, but all of you, we hope, are going to be leaders. And leaders need to be able to express themselves. That might be teaching you clinical skills. It might be inspiring new trainees. It might be sharing cases. So we have 2 verbal presentations as part of our assessment. So, ladies and gentlemen, I would encourage you always to follow your dreams. I hope your dream of education brings you to us. I'm looking forward to questions, and I'm going to hand back to Libby and our colleague students. Libby, thank you so much.
Super, thank you, Tim. So do post your questions if you have them into the chat, and that's fine. I'm really pleased we've been joined by a couple more of our students during that time. So I'm going to pin the students actually so that we can keep a close eye on them all, and you can point your questions towards them. So we've got Chris, I've got you up there first. Do you want to introduce yourself quickly?
Yeah, of course. Hopefully everyone can hear me. Hello, everyone. I'm Chris. I'm a paramedic based in the UK on the South Coast. I've just finished my year 1 of the ERM Masters. And I'm just going to be talking about the interprofessional or international aspects of the course. I don't want to dwell too much on the summer school, although I will briefly mention it because I think no one's going to cover that later. But for me, as a paramedic, it has been amazing to have sort of the influence from the other nurses, doctors, and other paramedics from various places in the UK, but also internationally, to hear their experiences of how their practice differs, but also how they're working in their departments and things. So for someone that works pre-hospitally predominantly, to hear how patients are treated in the hospital setting has been really invaluable. So for me, I feel like that has improved my practice and got me to think a little bit differently alongside the supplementary material that we've been having in the lectures throughout the year. So for me, I feel like my practice has definitely benefited from that, but equally I'll just briefly mention summer school, having the ability to talk to the guys who have come over from various countries about their cases and just how their practice differs has also made me think what more we can do in this country as well. So sort of remaining in our scope of practice, obviously, but having that sort of greater picture of what is actually out there. And for some of us, I'm sure, as well as Tim's mentioned with the tactical military austere medicine one, those that want to go into expedition medicine, it's really fascinating to hear about how medicine differs in those countries, because for someone with that sort of that background or aspiration to go into that sort of world and side of things, that also sheds a little bit of a picture in terms of what's available when working in those environments. So yeah, I've had a really good first year, and I think I'll pass over to the next student if that's okay.
Super, thank you, Chris. Latifa, do you want to go next?
Hi, everyone. My name is Latifa. I'm from Ghana. I'm a doctor. I live and work in Ghana. I just finished the first year of the Emergency and Resuscitation Medicine program, and it's been enlightening. It's been a lot of adventure for me personally, because it's opened me up to another form of learning. I'm currently a resident, so it's a lot of learning for me. But this was another dimension of learning in that this is level 7, full of research. Basically, you are doing topics you would have done in the clinic as well, but this is research based. And with everything you are learning, you are pushed to go further, even in your practice, because you pick topics which mostly are discussed in the tutorials. So there's a tutorial element I think Tim mentioned, which is a discussion among students and faculty. So you get perspectives, different perspectives, professional perspectives on topics that come up in your lectures weekly and your write-ups on your assignment. So these are things that are discussed, gives you an open-minded perspective about it, which you can write on later on in your assignment. But personally, it impacted my work ethic because it's pushed me to delve deeper on topics and cases. So the master's program has been enlightening, and quite recently at summer school, we are meeting students from all over different countries, which you would for the first year see virtually. So you meet them at summer school, and as Chris said, it's given perspective on different countries and how things are done differently everywhere. And coming back to research, it's trust me, you get different topics you want to research on because you are meeting different people, discussing different cases. And if you're a research enthusiast, it's a good platform for you to develop your research ethics and push you to want to do more research. Yeah, so it's been a good first year. I'm looking forward to second year, and faculty has been great. So yeah, that's what I have for you for now.
Thank you, Latifa. And no money was exchanged in the creation of this webinar, I promise. Thank you so much. We're going to move on to Luigi now, please.
Hi everyone. I'm Luigi. I am a lead resuscitation practitioner in Southeast London. My background is nursing. I am an adult nurse by background, qualified in Italy, worked in the UK for about 16 years now, mainly in acute medicine and ED, and research more recently. I found this master incredibly interesting. I found it challenging in the positive and negative way, in the sense, when I signed up for this master, I did want a challenge. I did want something that took me out of my day-to-day practice and what I feel comfortable in. And this program has definitely done it. Has taught me how to look for information. A lot of my job, I'm working as a resuscitation practitioner, a lot of my job is guidelines, and that's how my job is based, is how to think about out of the guidelines and how to find information outside of the guidelines, how to go that step further and becoming the expert really in that field, and how to find this information. Is challenging being a full-time student, well, a part-time student and a full-time employees, and work happens, life happens. We all need occasionally some time off, and it's how to balance these three main things on your life, which is work, the program, and your own life. And I think has taught me how to become smarter about what I need to do and what is important, and what kind of information are important for me for these. I should have said I just finished my second year, so I'm getting into the third year now. But I would encourage any of my nursing colleagues to get into this program, because compared to a lot of other programs, is very clinical, is very clinical based, and it's not something theoretical. It's something that you can use on your clinical practice. You can use on a day-to-day basis.
It's very practical, is what you're saying, Luigi, in terms of you can take the things that we're talking about and apply them in practice. It's not practical in the terms we don't practice procedures together, but
that's what I meant.
Yeah, no, that's cool. That's great. Thank you so much. That's great. And I'm going to pass over to Federico now. hopefully there.
Yeah, I am.
Hey!
Hi everyone. Hi Libby. Thanks for the invite. I'm Federico. I'm a doctor. I just finished the first year. I graduated in Italy, but then I moved here for training. So I'm training as an emergency medicine doctor in the UK. And I joined the program last year. I joined the program as because I wanted to do something more than the classic training pathway and doing only, you know, the ACCS training and then the exams that are required here in the UK to progress. I wanted to personalize my training and to do something more. And looking at the program, I couldn't wait to apply. It's been a great first year. The first 4 modules have been tough, but definitely they have deepened my knowledge in every sense. It's been great modules, great speaker. As most of the others said, we get like different opinions from world expert, and I think it's very good because you see how things are done differently in other countries, how we can improve our daily practice, how we can import and export different way to do things, because there's no right or wrong sometimes in emergency medicine and resuscitation. So it's very good to be able to apply different knowledge coming from different backgrounds. So definitely it did impact the way that I do things. I do things different. I do think about, you know, as Tim mentioned, in resuscitation, for example, we do need ultrasound. We need to have a better, deeper understanding of why a patient is shocked or why a patient is coming with a certain pathology, and therefore the master definitely helps to deal with this issue. And for me, especially having an interest in pre-hospital medicine, and there's a lot of experts talking about their experience in pre-hospital medicine. And as the others already mentioned, in summer school, you meet all these experts, and even the other students that come from different backgrounds, paramedics, nurses. So we do share a lot of experience. We do share a lot of stories. So it's very interesting. It can be, as Luigi maybe mentioned, sometimes challenging to juggle between, you know, your daily life and your work, but I think I was managed to finish all my assignment and to, you know, to pass. So I think, you know, it requires a bit of time to invest, but it is manageable. It's manageable from my perspective. And definitely highly recommended. It's a great program.
Thank you, Federico.
That's all right, no problem.
Do you want to just go on mute a minute? I'm getting an echo through your system. Right, speak. Thank you. Thank you all. So I think a lot of you have mentioned it's a balance of getting work and study time, and then also having some time in your life as well. So do you want to just sort of talk a little bit how you've managed to fit it into your work schedules? Because you all work in different ways. Some of you are on shifts, some of you are on more regular hours. Put your hand up if you want to go first. I don't mind. Or open your mic. Yeah, go, Chris.
Yeah, absolutely, no problem at all. So I'm sure, like many of the other guys, will have their own sort of unique way of managing work around the studies. For me, I recently transitioned from sort of a fixed full-time rota into sort of self-rostering. So still work full-time on the front line as a paramedic. However, I get to have a little bit more say on when I pick and choose my shifts. So for me, I have some sort of flexibility around when I can work, but also attend the tutorials and watch the lectures, which for me is more about time management, and luckily it's what worked out in my favor. It's been really interesting to attend a lot of the tutorials, as Tim says, to have that open and sort of conversation with the faculty, but also the other students as well, in terms of some of the academic papers, but also content on the lectures that are released prior to the tutorials. So for me, I found that it's been quite a nice blend of learning, being able to apply that learning to practice. As for me as a paramedic, I think I alluded to earlier, but didn't sort of fully expand on, is I now have a greater understanding of what happens in hospital. So when I take patients to hospital, I now know what they're going to do, rather than just taking them to hospital unknowingly, and how that influences the patient journey. So for me, that's been one benefit of it, but has also increased my knowledge around working in the hospital environment as a with just general resuscitation and sort of in medicine in that sense. So for me, I find it's quite a nice blend to work it around, and I actually enjoy attending the tutorials and watching the lectures. So I think if you enjoy something and you're passionate about it, it makes it 10 times easier. So hopefully that's helped a little bit. But like Livy said and Tim said in the chat, if you have any questions, just ping them in the chat, and hopefully we can answer them for you.
Awesome, thank you. Who else? Anybody else? Go, Luigi.
So for me, I work more of a regular, regular job and more office-based Monday to Friday. I was lucky; I had some study leave as part of my agreement within work, because I accessed this master's through work because it's relevant from my practice. So part of my time was within working time, but I think one of the reasons why I chose this program is because it was online based, and I was able to manage my time a lot better because of working more or less office hours. My evenings tend to be free, and for some reason I work a lot better in the evening than I work during the day. So I did used to watch a lot of lectures, well, not a lot of lectures, but I watch a couple of lectures every day after I go back home, and then obviously on my days off I would catch up with the remaining ones. Try to get your study leave day off on the Thursday to get the tutorial. That didn't always happen, but again, everything is recorded, and chances are that if you have a question, someone else might have the same question. So a lot of my questions were answered in the tutorial, even if I wasn't there. Is not as productive watching the tutorial on a recording rather than being present. But sometimes, again, you just have to work that out. But for me, having the freedom of watching the lectures within my own time and whenever was useful for me, sometimes it was weekend, sometimes it was late at night, made everything a lot easier because I could plan it around work and life.
Super, thank you, Luigi. Yeah, go, Latifa.
So very much the same thing as everyone is saying, but I remember for module 1, I really had a bit of a struggle because it was new to me. I had to juggle between my shifts and making time for schoolwork and all of that. But eventually I had to put in requests when my rota comes to have certain shifts moved to certain times for me, because I had to make time in my schedule to make time for school. And sometimes you have me listening to my lectures on my way to work or on my way home. But specifically for tutorial, just as Luigi said, the tutorial is better listened in live than having the recordings. So for Thursdays, I put in a request for Thursdays. And sometimes it will mean me moving my lunch break a bit further so I can have the 1 hour for tutorial on Thursdays. So it's how you move things around for yourself, because it's a distance program and you still try to get as much out of it as possible. So you draw your schedules alongside what the schoolwork demands of you. It's not an easy work. It's adult education, so you have to move your life around to fit in, so you still benefit as much as you should. Yeah, thank you.
Yeah, and we know that some people have fixed shifts and they've got no ability to move things around, but we really encourage people as much as possible where they can to make that space on a Thursday, because those who join the tutorials seem to get a lot out of being present in those. And we know the tutorial times are set at the beginning of the year. They're always on Thursdays. They run from the 2nd or 3rd week in September through to the middle of May. So it's pretty sort of set within that. And they're either at 11 a.m. British time or 1 p.m. British time, depending on which module you're sitting at the time. So so it's great when students have managed to sort of create that time around it and to be able to come in. That's really good. And we've been joined by one of our other students, Deborah. She's thank you so much. She's been ferrying people around and managed to make it here. Deborah, do you want to just introduce yourself and tell them a little bit about your experience? Is that all right?
Hi Libby. Can you hear me okay?
Yeah, perfect.
Yes, I work at DSTL Porton Down as a research scientist. I am ex-military, so I was a military combat medic and then a biomedical scientist in the military. So now I work within trauma research, so we did develop a lot of protocol, confusion work and things like that. So the course has been really beneficial for me because we kind of go quite in depth into trauma, even though I'm not actually working as such with patients in trauma. It's really helped and been beneficial for all the actual work and research what we're actually doing.
That's great. And you came along to summer school as well, didn't you, Deborah, for the more practical side of things?
I did, yeah. Summer school was really enjoyable. I was a bit apprehensive to start with, but it was really good. And a lot of the things that we did on there, like the POCUS, we're actually integrating POCUS into some research we're doing now as well, because there isn't anyone with the experience in the department I'm working in. So we're actually developing that now, and that's something that they wouldn't have been able to do unless I actually learnt that on the summer school. So that was really
cool. POCUS is point of care ultrasound, for those who are wondering about that. And what do you think has been the most challenging thing this year for you, Deborah?
I think because I'm a single parent, I've got 2 children and a grandchild, and I work full time, so sometimes I work 50 hours a week and doing the MSc, but it has been manageable. So I think I tended to kind of start my assignments a little bit late, so it was challenging trying to get them in on time. But the weekly tutorials really helped because the amount of lectures, sometimes there is quite a lot of lectures, but managing, so I kind of did those in the evenings. So yeah, it has been manageable. It has been really enjoyable, even with the full-time job and lots of other commitments. It is been really good, and I've managed to keep on top of everything. But yeah, so I think the most challenging is probably getting the assignments in on time, but not leaving it as late. So next year I'll make sure I start them a lot earlier.
Yeah, so the assignments are due every 8 weeks for a sort of a rolling sort of 32 weeks within the year. So it does come around quite quickly each time. And we know that, but actually keeping on top of them allows you to go into the next module, and they're specifically designed so you have to hand in the assignment at the end of the module before you start work on something completely different, so that you can keep your focus in that area. One of the challenges for us as faculty is to turn things around so you get your feedback on those assignments back in time for the next one, which is something we're working really hard to do, and we're always trying to listen to the students and trying to get things better. We know it's not all perfect. What about the interprofessional mix on the course? A couple of you talked about it a little bit more, and the international mix. Do any of you want to talk about that a little bit further for me?
I think it was really good, especially meeting a lot of the students on summer school, and it kind of brings in a lot of variety. And some of the doctors from overseas who I was talking to at summer school, like it's really interesting to see the differences in what different practices do and different work overseas, and how it is like a lot of stuff we're learning on the course that actually is beneficial to help people kind of integrate that overseas and learn more. So it is really good, and it's been good obviously seeing everyone on the tutorials, but then seeing everyone face to face at the summer school. That was really good, and we'll keeping in touch with each other now. So yeah, so I think definitely really interesting to see the differences.
And you have a WhatsApp group, don't you, for all keeping in touch as well? So there's a lot of chat going on within that. Anybody else? Federico, obviously you trained in Italy, you've now come back and you're training in the UK, but you've got quite a mixed international mix within the course itself. How are you finding that?
I think, as I said, it's very interesting because you get different opinions in every country. They might do things differently. Like, for example, one of the example that comes to my mind is about in the UK we don't do noradrenaline peripherally, and in other countries such as Italy, such as Australia, they instead do, which makes life much easier to manage patient with shock. So it was interesting to share that the learning in other countries where there's probably less resources than the UK, that they might need to adapt to different sort of diseases, to different pathology differently, as we do in the UK. So is a quite an interesting mix of a different opinion. And as I said, there's not right or wrong sometimes to do things differently. And as well in summer school is very nice to be able to share. There's different opinions, there's different ways to do things, and then you learn that you can bring different practice into your own practice, learning from other students and learning from other faculties or experts on a certain topic.
Cool, thank you. I've had one question that's come through to me directly, which I'm going to answer now because I don't have time to type while I was trying to facilitate and everything else. But and Tim, you can follow up on this. But what's the difference in the content, the level of detail in comparison to the FRCEM, which is the doctor's exams for the Fellowship of the Royal College of Emergency Medicine in the UK, for those who aren't familiar with it? We haven't got any of the students on the call today who've got their FRChem, but we do have students who have come through the programme who are either finished their fellowships or consultant level as well. What they have reported back to me is that they find this is a much greater depth of knowledge in terms of the science and the pathophysiology, and really understanding the research and that goes in behind and understanding why we do certain things. So for instance, like Luigi said, in terms of writing his guidelines and really understanding how a process works, or understanding fluids and things like that, and having that really in-depth knowledge, that's much deeper that you get on this master's program than you get from the FRCEM. And it's designed to be much more orientated towards that sort of research and education side and depth of clinical knowledge, rather than the more practical and much global approach that you have within the FRCEM. Tim, do you want to expand on that further?
Yeah, I mean, Libby, thank you for that, and thank you for the question. It's very pertinent. So the detail that we teach about resuscitation is beyond the UK consultant qualification, or indeed any country's qualification for a consultant. What we're trying to do is develop your skills to be a subspecialist. That means if you're a doctor, you might want to be the consultant that manages resus or trains the other consultants in resus, or perhaps you've taken the lead to liaise with intensive care or anaesthesia. That skill base demands a set of knowledge beyond the usual. Now, I trained in Australia in intensive care and emergency medicine, and what we teach on the masters is probably a little beyond both of those, depending on the details of the individual who study. I mean, I always liked resuscitation, so when I did my exams, I studied beyond the requirements just to pass the Australian fellowship, the UK fellowship, or the intensive care fellowship. But they're answering very different questions. You're taking your FRChem to answer the question, have I reached the average standard for an emergency physician to apply for a consultant contract? You're taking a master's to answer the question that you want to be a subspecialist with an interest and leadership skills within a very focused area. So in emergency medicine, we see people take masters in, well, resuscitation, obviously, but others may choose point of care ultrasound, others toxicology, others may do a business leadership, and similar for nurses and similar for paramedics. If we apply that question to paramedics, then what we're teaching is probably most similar to what you'll be required of for a HEMS training. However, the theoretical detail that we require and we teach in the masters is well beyond HEMS. I mean, I've spent 10 years with London HEMS and similar time with EAAA, and I now work with an Australian retrieval system, and the level that we teach our paramedics in the masters is well beyond any of them. I've said enough now, and I can see other questions, so I'll turn my attention to the type and hand back to Libby.
Thank you, Tim. So just going through, there's a question about when summer school is most beneficial, if it's after first or second year. As Amy said, we encourage and try and give it to first years first, because the idea is then you build more of a community to come back into second year. Luigi, you joined at the end of first year. You've just finished your second year now of the programme. How did you find that made any changes to you in year two?
Yes, it definitely did. And I found I would have joined, so I did it at the end of year one, and I would have joined also at the end of year two if I actually had leave to do it. I found it very beneficial. And again, it's, putting into practice this. is a master and is very theoretical, and that is the only chance you've got to put into practice what you've studied, and especially about point of care ultrasound. You can study a lot about ultrasound, but for someone like me, I'm a nurse by background, so I don't use ultrasound very regularly. So to have the practice of doing it on patients, well, people, real people anyway, was actually incredibly beneficial. And I think, as Libby said, is, it creates that community that then you go in year 2 with finally knowing who you're talking to through the chat. Some faces, you recognize some faces, and I think it's very beneficial in year 1. If you can't do it on year 1, by all means, do it on year 2, because it's still going to be beneficial. But I think year 1 is a nice kind of step to actually start meeting people halfway down your path.
Yeah, thank you. And there's a couple of other questions about it. Summer school is not compulsory at all. So there's no compulsory face-to-face practical aspect of this course. Summer school is merely a bonus, and it's an extra chance because we wanted people to have a chance to come face-to-face and to do some practical skills. So it's not compulsory at all. It doesn't affect your marks if you come or if you don't come, because it doesn't play into all of that. Some of the things relate to content in year 1, some year 2, but it's meant to work across both sections. And if we have spaces, people can come more than once. So certainly last year we had people who'd come the year before as well. But we know that funding is tight at the moment, and it's difficult for people to get time off work and to come and to be able to afford to do that. Summer school lasts for a week. It's 5 days, but we had split it this year, so people could come just for the first 3 days if they wanted to, rather than coming for the whole 5 days if that was more fitting with their rotas. And a couple of people did do that, and they're hoping to come back next year and do the other part of it. But it usually happens in the mid to late June. It just depends. We have to work it around the international conference schedule, where half of the faculty disappear off in order to present, and about university holidays and access to different things. So there's lots of things that sort of relate to when it happens and when it comes on. We've also invited students to come back and help teach on summer school when they've said that it's something that there's things that we're missing out on there. So one thing we're keen to do, and Queen Mary's is really keen to do, is to work with students in order to develop the course and to get things in the best possible place where they can be. I wanted to go back to the students and ask something else. I wanted to see if you had some examples of where you've actually applied the things you've learnt in the master's programme to your work. If you had sort of practical examples of how it's changed the way you've worked, or the way that you're planning to do and what you're planning to do in the future, and if anybody was able to answer that. Yeah, go Chris.
Yeah, I'm happy. So for myself, the reason why I'm doing the masters is to sort of get more of an insight into the emergency resuscitation medicine, but also to try and progress in my career. So spent a number of years in the NHS frontline ambulance service. I have a little bit of background in sort of expedition, but also event medicine as well. And for me, I kind of like the idea of progressing into more of a FEM role, whether that be sort of in HEMS or sort of a split between sort of in hospital or sort of ACP world as well. So for me, this program has been really invaluable and has sort of encouraged me and challenged me to push the boundaries a little bit, to learn a lot about things which we don't normally routinely do as a paramedic out on the roads, which has later helped me sort of when also undertaking some work in the hospital as well, but also being able to talk to my colleagues and sort of educate those through various channels as well. So for me, this master's has been so beneficial to ongoing patient care, and I'm sure will continue to do so as I go through the year. The focus to me, as I think Luigi was alluding to, as a paramedic, I don't routinely use ultrasounds either. However, when I have had some of the pre-hospital teams out from HEMS, etc., it's really interesting to sort of see what they're looking at and be actually able to identify some of the landmarks and features now as well, or even to have the ability to suggest it for a patient which may be requiring a little bit of extra diagnostic assessments. An example of that is the other day when running a cardiac arrest free hospitally, where we had quite a long a protracted arrest, and decision was considered to use POCUS in order to determine the potential cause of the arrest. So for me, this is just all very invaluable, and it's been very exciting to sort of learn about it, although not using it in day-to-day practice. But yeah, I would again just highly recommend anyone that wants to sort of push the boundaries, challenge themselves a little bit, wants to progress clinically in their careers. It's definitely going to do that for you.
Thanks, Chris. Latifa, you were going to say something? Thank you.
Hi, Lizzie. I just wanted, and I may have to run off. I just had an hour off my shift, so I put this in and I may run off. So I just wanted to talk about the POCUS, which I went through at summer school. I took part in the advanced course. POCUS is something I use in my practice on a daily. But since I've come back, it's like I want to put the probe on everything, you know, because I saw I want to put the probe on everything. Especially for cardiac cases, I see a lot of PEs and a lot of shock cases. I want to put the probe on everything because I want to explore what I got from summer school. So it's been a bit of adventure for me since I've been back. So I recommend summer school to everybody. It's not mandatory, but it's really good if you partake in summer school. Yeah, you have a different perspective of everything you've done virtually. And
but I think what you've shown there, Latifa, is the curiosity that you've developed through the course. So actually it's made you want to go and use that skill. So whether it's talking about how to use point of care testing, you know, and actually, well, what can I do within my department, or what fluids are we using, or whatever it might be, blood products and things like that, you know, hopefully that experience on the MSc is wanting you to go and
that's right. I think it's just
practice.
My curiosity and trying to merge the practical of what I've been learning virtually, and now I've seen a practical bit of it, and I'm trying to transfer it onto my practice on a personal level. So it's that curiosity in trying to merge everything I've gathered and what I've practiced to hands-on what I'm doing now. You know, yeah. So basically that's, but I recommend summer school to everybody.
Thank you. Yeah, that was great to have you over. It was fantastic.
Yeah, thanks, guys.
You've got to go back to your shift, so thank you so much for taking your time out. And this is what happens in tutorials as well. People join us and then they drop back. We have people joining from ambulances and various other things. John, are you in an ambulance now, or are you back on base? Just joining us, having completed a transfer across the southeast of England, I know. Looking a bit warm and green there in your uniform, but you're on mute at the moment.
Yes, I am now back on station. I finished slightly later than planned, but yes, it's been an interesting day.
Good. And do you want to just tell us a little bit who you are? And you've just finished third year of the MSc, so you've got another perspective to the other students who are on the call.
I have, yeah. So my name's John. I'm a lead paramedic for learning development based in the southwest in the UK. As Libby said, I've just finished my third year of the MSc. It's been a really fun and interesting 3 years. Would highly recommend the course. My particular interest is with sort of simulation-based teaching, and I've become involved in helping with the summer school.
Great. And what's been the biggest impact of the last 3 years on your clinical practice?
So the biggest impact, even though it's been a sort of a resuscitation and emergency medicine-based master's, is the sort of the increase in knowledge that's helped with safely managing people when we've been sort of experienced for hospital handover delays, and having a greater knowledge base so we can manage people safely on the back of the ambulances, and also with sort of triage and treatment dispositions when discharging on scene. There's some sort of extra theoretical knowledge that I've gained through the course has really sort of helped make me more sort of risk aware and more comfortable making better patient interest decisions. It's, you know, it's a great master's, but it's certainly not all about, you know, the Gucci and the fun skills. You can apply it to more than just emergency and resuscitation medicine.
Yes, and we don't just do Gucci stuff by any means. So what Gucci's different for everybody, isn't it? We should say. So everybody
Absolutely.
has different things that apply to want to do from there. Tim or Amy, are there any questions through the chat that I've missed out on so far that we need to address or ask the students? I see you've all been answering furiously. All good?
I don't think there's anything to particularly highlight unless the people that ask the questions want me to expand, but I've been typing the answers as they go. So guys and girls, those of you that typed a question, is there anything you'd like me to expand on, or Libby to expand on, or Chris to expand on at this time? And I love the word Gucci. I'd never heard of Gucci. I was just closing my eyes thinking of a Gucci handbag and then an airway. It's an interesting cross. I'm good. I'm not a designer because I'd like to make a mess of it. But obviously John has these tremendous skills. And hey, that guy's sim is Gucci. It's the best.
Does anybody want to take their mic off and ask any questions as well? Yeah. That was John. So, Luigi, anything to sum up or say at the end before we let people disappear off to their evenings and you can all go and have some food and drink and whatever else you might need? Go and watch some lectures.
Yeah, I think going back to what Chris said is, having that greater understanding and having that curiosity of things that you now have a better understanding of. Now I always look at the screen of a POCUS and didn't really understand a lot. Now, although again, I'm usually not the one using the probe, I've got an understanding of what I'm looking at. I've got an understanding of why we're using it. And it has increased my understanding and and it empowers me to actually discuss the patient at a deeper level with the rest of the team. And I think the multidisciplinary part of this program actually reflect very much what happens in real life, because we all work together, and I work with doctors on a daily basis and I work with paramedics very frequently in the emergency department, and he makes it so much realistic, especially in the summer school, when you actually have those conversations within different professionals. And I think again, has given me that curiosity and that empowerment to actually go a step forward.
Super, thank you. Federico, over to you. Anything you want to add or say before we?
I think just reiterate that it's a great program. He helped me to develop a deeper knowledge in a lot of different fields of emergency and resuscitation medicine. It's given great pleasure to be surrounded by faculty like Libby, like Tim, who radiates knowledge from that aura. And it is good because I think with evidence-based medicine, you can challenge a lot of decision with your colleagues, with different teams, and the evidence is there. If you have it in the back of your head, you can support your decision with everything what we studied in the master.
Super, thank you, Fed. Deborah, anything to add?
Yeah, I just think as well as all the lectures being really broad and really interesting that cover a great deal of detail. I think all the kind of the admin and the sort of pastoral care as well side is really good. Every time you need to answer a question, there's always either you, like, or Tim, or the other faculty, or Amy or Chris side of things. They always get in touch really quickly and are really helpful. And I've got other colleagues who are doing other master's degree programs in different areas, and they, quite disappointed how, they're kind of taken care of. But I've always felt part of the team, and the admin has been really, really good as well.
Thank you for that. And actually, just being distance learning students, you're still a part of Queen Mary's University. You have access to all of the library facilities. You have access to all of the dyslexia support services, for instance, the pastoral services, the careers advice, and everything like that. So just because you're not present on campus doesn't mean you can't access everything that Queen Mary's has to offer to any other postgraduate students. And so it's really important to know that, whether you're in the UK, abroad, regardless of how this is working. So yeah, taking advantage of those is really key and important. John, I don't know if you're still there or if you want to say anything. Thank you for sneaking in at the last minute.
Yeah, certainly still here. It's a truly world-class program, this Masters. We've got some amazing faculty on it. You know, we've got Tim, Libby, Brian Burns, you know, just to name a few. And the great thing is you get to meet with colleagues from around the world and compare what people are doing in their own shops and try and, you know, bring their practice into your own. And it's just one big learning experience. And the opportunities you get from it are incredible. The summer school is fantastic, particularly the simulations, if I do say so myself. It's an amazing program with some great lectures and really does, you know, put your clinical practice up to the next level, and 15 out of 10 would recommend.
Thank you, John. That's really kind. And Chris, anything final from you?
No, I think yeah, just to echo what John and all the others have said. I mean, it's an absolutely fantastic course, and it's got some world leading experts teaching on the program. So yeah, as I said before, for me it's been a massive change for my practice, and I've learned so much, and I'm sure I'll continue to learn more as I go through. So I think anyone that's thinking of or even considering joining the program, I think just do it. So yeah, I can't recommend it enough, and especially the summer school as well.
Oh, brilliant. Thank you all. And we all learn from you continuously, you know, and that's what's fantastic, is we're all continuous learners. You know, even on our modules, and you're bringing in your own practices. I was leading the toxicology and CBRN, and there'd been an incident in the UK the week before, and one of our colleagues had responded to it, and they're able to bring that learning directly into the tutorial that week and to bring everything really alive. And we just love all of that, you know, when we're learning from around the world and from you all. So that's great. Tim, I'm going to thank you all, to all the students, for coming and joining us today. It really makes a big difference. And thank you who've joined us on the webinar and wanted to find out more and to ask some questions. And that's really, really important to us. You are welcome to ping myself or Tim directly on our emails, and it's all available. And do look at the website, which Amy has put up there as well, for more information, if we can answer any of your questions. We're encouraging people who haven't signed up and want to come and join us and start studying in September. The sooner you sign up, the better, because actually it can take 2 or 3 weeks to get the paperwork through in QM. And so if you leave it till the last minute, sometimes this can lead to a delay in actually joining the first week or two. And I'm going to hand over to Tim, who conceived this idea and whose brilliant program it is, and he leads us all with great aplomb to finish it off. Thank you, Tim.
Libby, thank you very much for putting this together, and your superb leadership and chairwomanship as always. So, ladies and gentlemen, this is a two-way course. I can't stress how much that at level 7 it's about teaching yourself, and this course works for really one reason: the students. These guys inspire us. They make the faculty work hard, because we've got to stay ahead of these guys and girls, and they are so bright and motivated, and it's an absolute pleasure to study with them. And I'd like to thank all of you in the room for feedback. Just for what it's worth, the feedback we got this year was 100% score, which we've never had before. This is in education teaching. There was areas that we need to improve on in marking, but it was the top mark in the Blizzard and the university, and I'm absolutely humbled. So thank you very much for that. And you know, I've done this job 30 years, and I'm in no doubt the thing I enjoy most is the interaction with all of these guys and girls on this program. It's a wonderful privilege to be able to learn with people. And for those in the room that are considering learning, I really hope that I get to welcome you into the course in September. And with that, I think it's time for us all to wish you a good evening. Libby, thank you so much. Luigi, Chris, John, Debbie, actually I can't go and name everybody because we'll be here all night. And hey, Parker, it was lovely to put a name and a face to you as well after our interaction. And Federico, enjoy the proper sunshine. Amy, thank you for joining us. And ladies and gentlemen, have a wonderful weekend. Take care.
Thank you, everybody. Thank you so much.